Rachel, great to see you today.
Hi.
How are you doing?
I don't know, I'm just feeling a little bit worried and kind of anxious today.
Are you feeling anxious because, as you know, this is our last session together?
Yeah, I'm just not quite sure that I can do everything that we've, accomplished in therapy on my own. I don't know.
Okay, well, let's take a minute and look back at all the things we have accomplished and maybe we can change your mind, before you leave. So, when therapy first started out, you were really anxious about your procrastination, and it was affecting areas of your life as far as school and your friendships and your relationships. Let's talk about how those have changed.
I guess with school, I've gotten a lot better at studying every single day instead of just waiting all till the end, and that's actually helped reduce my anxiety. And with my family, I guess I've made stronger relationships with them, and I'm able to call them now myself without them calling me every day, like we had started with. And I've even fixed some of the relationships with friends who I hadn't talked to in a few months. So I guess I have made quite a bit of progress. I'm not sure if I can keep doing it on my own without getting homework and guidance from you and you reporting to you. I feel like if I don't have anybody to report to, I might just stop doing everything I did.
Well, let's just look back to how you feel once you completed these things, and maybe that'll keep you motivated to keep working on them.
Yeah, I guess I do feel really good after I finish a test, and I know I did really well on it, and I didn't have to cram for it, and weeks before tests are really stress-free. And I guess having my family understand what I'm going through and understand my procrastination problem, they really have helped supported me, and which makes me feel better and less guilty about all my problems. So I guess maybe I can look back on, or I can remember all the progress I made on my own and how not procrastinating makes me feel and makes my life better, and maybe I can actually keep doing that.
So throughout therapy, you've learned that leaning on your family can be really helpful.
Yeah, I guess I could actually use them as people to report to. I mean, I could give my mom, tell my mom how I'm doing with my procrastination, and if I'm starting to slack, she can maybe give me some advice too and help keep me motivated towards my goals, and maybe remind me even of the things I've accomplished, because sometimes I tend to forget how far I've come.
Yeah, I think as your mom, she's going to know a lot of the same things that I've learned about you throughout this therapy journey, and that's like your strengths. You've been very insightful and very positive to try to get to working in the right direction. So having her tell you those things too could really reassure you and keep you on the right track.
Yeah, you have pointed out a lot of my strengths and how I do set goals pretty high, but if I just learn to partialize them, then eventually I'll reach them. So I just have to keep all that in mind, I guess.
Yeah, so before you go today, maybe we can even do a little more therapy and discuss what your plans for the future are and how we can set some goals now to motivate you to get there.
Yeah, I guess for the future, I'd just probably like to maintain where I'm at and to maybe even make a few more friends than I have, because I just have been trying to keep my friends zone, or whatever you want to call it, to a minimum, just so that I can actually have meaningful relationships with people and actually have time to respond to them. But maybe in the future I can expand my friends and even learn how to prioritize different people and which friendships need more contact and which people I need to talk to more.
Right. Tell me a little bit about your career goals. What do you want to do?
I guess I'd like to eventually get out of school and go to graduate school, which my procrastination stuff I've learned will really help with that, because I'll be doing schoolwork for a lot longer. And even I'd like to be a clinical psychologist, and as a clinical psychologist, I need to keep up on my work and not procrastinate my patients. I mean, I can't just decide that I'm not going to call a patient back. I'll have to contact them as soon as possible, so that'll really help me.
Good. It sounds like you have great goals for yourself, and I think what you've learned can really help you reach them, and I hope it does. Do you have any questions or concerns?
I'm actually feeling quite a bit better about therapy ending now. I'm not as worried or anxious. It really helped me see all that I've accomplished and all that I can do on my own. So.
Well, I'm really glad to hear that. And since this is our last meeting together, I just want you to know that if you ever need professional help again, that our office is always open for you. And
Okay.
yeah. Well, Rachel, this is our last meeting and it's almost coming to an end. So I'd just like to ask you again if there are any questions that you have for me about the process or what's next.
I don't. I think I'm pretty confident that I can do this on my own now.
Okay, good. And yeah, I'd just like to reiterate some of the strengths and the goals that you've accomplished here, and I hope that that positivity and motivation can stick with you in your future endeavors. And I've noticed towards the end of this meeting too, you seem happier and you seem more satisfied with what we've done, and that's great to see, and I just hope that you take that with you on your next journey. And I would also like you to know that since this is our last meeting, you are always welcome back here at our practice, and if you're ever experiencing any difficulties and need to work through it, that we're always here to help.
Okay, I actually do have one question. If I just am having like a small problem, is it like okay for me to just call your office and have just a short conversation with you, or do I need to come in for an entire therapy session?
Yeah, that's okay. If you ever have a question or just need a little advice or help, you have the number to my office and you're always welcome to call.
Okay, thank you.
Thank you, Rachel.